Good morning, Dr. Demestri here, board certified plastic surgeon, talking about implants, whether it's cosmetic implants or implants for breast reconstruction, and why they shift. So the first thing to understand is once we place a implant into the body, it doesn't matter if it's a silicone implant, a saline implant, your body responds by sealing it off from the rest of you with a thin layer of scar tissue that is known as the implant capsule or the implant pocket. That scar layer ultimately determines where that implant sits and stays. So there's a couple of reasons why the implant may shift, and that relates to capsule loosening. So the scar envelope around that implant stretches. You now have a bigger space than the size of the implant, and that's where if you're at rest, the implant sits there. If you lean back, it has room to shift to the side, and the implant can move around too much. And with gravity, the implant would go down and out, whereas most people want to keep it up and in. So there's a few things. First of all, at the time of your implant placement, I recommend 3 months of downtime from upper body exercise and stretch, and I'm on the more conservative end of activity restrictions. The reasoning for that is that capsule takes 3 months to reach its final strength. After that, it's as strong as it's going to be. It can still stretch, but you've at least done everything you can to keep things stable and without stretching too much during that 3-month time, so the capsule can kind of lock in to that position. With that, often that is sufficient to protect the position of the implant. That being said, some people produce a weaker capsule for whatever reason. If you are someone that is shown to have a weak capsule, so you have that initial implant placement, you've done all of your activity restrictions, everything has been reinforced, and yet it's still at 6 months, at a year, it's really loose and the implants have slid down, then you may need extra support. That's when we talk about using the internal bra, which is a sling of dissolvable mesh that's made out of the same substance as our really strong stitches. What happens is then the implant gets placed, that sling of mesh or internal bra gets wrapped directly around the implant, anchoring it into position, and then your body forms a capsule on top of that. So it's got that extra layer of support. Even though that mesh or internal bra dissolves, it does a couple of things. First of all, it is bearing the weight of the implant for that entire healing process of the capsule and beyond. The stronger meshes, the Galaflex, can last for 18 months, and in that time frame, your skin isn't bearing any of the weight, the capsule isn't bearing any of the weight, and it is doing that heavy-duty job of keeping the implant in position. And then secondly, it's replaced by a thin layer of collagen, so it's got some longer lasting strength that's keeping that implant up into place. So that may be something that you need if your body produces a weak capsule. But the activity restrictions, the full-time bra use for the first 3 months are super important as far as setting that initial strength. And then long-term too. I mean, bra use is optional, but this is a heavy object. The more that you just let it hang without support, without bra support, the quicker that capsule is going to loosen. So absolutely, when you're doing exercise, if you're having a busy day, you want to be in a bra as much as possible to support them. If you don't, it's not that they're just going to fall to the floor, but they will loosen a little bit quicker, and you won't get quite as good of longevity out of your results. Hope that helps.